Hello, world and universe. Welcome to the Trevor Donald Experience. Manifest your truth. This channel is an organic amalgamation for searching, seeking, and finding the truth in this chaotic, confusing, and disruptive world we live in. This story is about one of my beloved cities right here in St. Louis City. And I'm going to give some cross comparisons between the chaos and disruption in St. Louis City and what is going on in St. Louis County and its chaos and disruption. So, I've done stories before. St. Louis City has its issues. The May 16th, 2025 devastating tornado destruction that occurred last year, advancing a poor, derelict city to more vacant, abandoned homes and buildings, multiple superintendents at the St. Louis public school system that we've had in the last 2 to 3 years that have been removed for all kinds of unprofessional reasons. There's been issues at the St. Louis Sheriff's Department, as we know, and many issues at the St. Louis City Justice Center. With at least 20 to 26 people that have died in custody at the St. Louis Justice Center since the year 2020. That's like 5 deaths a year, way too many. And now St. Louis County is having all kinds of problems. For starters, St. Louis County Executive, Dr. Sam Page, got indicted last year. St. Louis County also is navigating a severe ongoing financial crisis stemming from an initial $81 million projected deficit in the 2026 spending plan. And now public health leaders in St. Louis County warn jail residents that their health care is at risk if the county council does not approve funding for contracted medical staff by the end of June. So we're talking about primarily nurses, medical assistants, physicians, to maintain a healthy medical paradigm and platform in the St. Louis County Jail. There are roughly around 1,200 inmates at the county jail. 2 ironies here. One is the county council mistakenly left out $2.8 million that's needed for the medical staff, to fund the medical staff, to pay the salaries for the medical staff budget. And how do you forget the medical staff budget when the St. Louis County Executive, Dr. Sam Page, is a physician and an anesthesiologist? How does the medical budget get left out mistakenly? And the leader of the St. Louis County executive position is a physician and an anesthesiologist. Duh. St. Louis City and St. Louis County has chaos and disruption all at the same time, and both are on the brink of falling apart financially and fiscally. So let's get into this story about what in the hell is going on in St. Louis County. Health officials warn that detainees at the St. Louis County Justice Center or jail might experience delays or lose health care altogether if the county council does not approve funding for contracted medical staff by the end of June of this year, 2026. Dr. Kanika Cunningham, director of the St. Louis County Department of Public Health, sent a letter out to the jail's roughly 1,200 residents about the situation. She said the jail needs at least $2.8 million. Funding the county council mistakenly left out of this year's jail budget, according to Dr. Cunningham. She said the funding would help secure contracted medical staff for the rest of the year. If there's no medical staff, we've got 20 to 26 deaths that have taken place in the St. Louis City Justice Center. They're understaffed, underfunded, underappreciated, with correctional officers understaffing, There's a shortage of sheriffs. There is a shortage of medical staff at the St. Louis City Justice Center. And now we're having an issue where they are not even appropriating the appropriate amount of money to have a full medical staff in the St. Louis County Jail. So there are going to be people that are going to be dying. We're talking about people, many inmates that have poor health care, low IQ, probably haven't seen a doctor in 10, 15, 20, or 20 years since they were kids. And there are going to be all kind of, you have assaults, you have fights that take place in these jails, whether city or county. You need a medical staff in order to make sure that these people at least have the appropriate care that's needed. Dr. Cunningham says, I don't have the best relationship with the county council, but at some point you've got to let the politics die. She said this during a press conference at the county jail. This is about patient lives. This is what I just said. It is about a life or death situation. And you have to know when to separate your personal, professional feelings about her and about the work that she does, and take care of the people who elected you, and take care of the people that's under our care here at the jail. Dr. Cunningham said the council has held Bill 72. Remember this, I tell you all the time, pay attention to your city and your state, your local politics, and these bills that are being passed and legislated on your behalf. You have to open your eyes and ears and raise your level of consciousness and read. So Dr. Cunningham said the council has held, it's called Bill 72, since April 21st of this year, which would fund the $2.8 million needed for contracted medical staff, such as nurses. The bill states the money would come from the county's general revenue fund. The contracted staff members are essential for managing chronic and acute care, Dr. Cunningham said. She said they help residents manage health issues like hypertension, high blood pressure, diabetes, and as well as deliver psychiatric medicine, as well as deliver those medications to the inmates that need it and whose health care is compromised. Dr. Cunningham added that without contracted nurses, who make up 70% of the medical staff, the jail cannot meet the health care needs of the detainees. They're people too. Everybody that gets arrested is not already proven guilty. Innocent people get arrested. It could happen to anyone. Just because you're locked up or detained does not mean you're necessarily guilty. And we're all human beings. Where is the humanity, the ethical and moral values of treating human beings appropriately? How do you jail somebody and not have a medical staff? There are all kinds of things that can take place when you're confined. And how would you like if that was you or one of your family members that were locked up for whatever reason and they needed, their health is compromised and they need appropriate health care but can't find anybody that's there? We wouldn't have a way to cover the contract. So unfortunately, the contractors, they will pull their staff back because the county is not able to pay the staff. That's what Dr. Cunningham is saying. Cunningham emphasized that detainees have a constitutional right to health care. That is correct. They're still human beings. They're still U.S. citizens. She called for community support and advocated for the council to act swiftly to prevent severe health risks and legal repercussions. Because trust me, if people die while there is no medical oversight or no medical umbrella to treat these detainees, the lawyers, the sharks in the water, they are going to come after. If the St. Louis County is already at an $81 million deficit, if a few people die or multiple detainees die in the St. Louis County Jail, these big time lawyers are going to eat up St. Louis County, their budget. The lawsuits will come from all over the place and it will be inundated. There will be a subterfuge of lawsuits in the St. Louis County courts. and it will be a major payday. The bank vaults will open widely when these lawyers get a hand of these potential lawsuits that can take place if there's no medical oversight or medical care for these detainees. She said there was a jail death there just a few months ago, Dr. Cunningham said. It was the swift action of the team to be able to intervene. So this is not a time to cancel access to health care. We have medical emergencies that take place, but we've done a pretty good job of being able to either make it there in time, get them to the emergency department, or get individuals the proper high-level treatment that they need. Robin Marshall Smith died in custody in February due to a medical issue. Police said they were investigating whether or not she received the proper medical care. This was Robin Marshall Smith, just died in February. She's one of at least 6 people who have died in custody in the St. Louis County Jail since 2020. That's at least 6. In St. Louis City justice system, they've had up to 26 people die since 2020. You don't go to jail to die. If you get arrested and go to jail, or you're detained, you're waiting to see if you can get the appropriate legal help and fight your case. It shouldn't be a death sentence if you get arrested. Jail officials last year told council members that millions of dollars would be needed over the next 5 years to hire staff, provide greater training, increase mental health resources, and provide new clothing for residents and conduct maintenance of the 27-year-old building. The calls for more funding have not been met yet, however. The county council cut the jail's budget late last year, both in an attempt to address the county's dire financial situation and because officials said the jail had some underspent funds. County council member Shalonda Webb, the jail's council liaison, did not immediately respond to requests for comment. The Clayton's jail general budget was $40.4 million last year, and jail management had requested just over $41.3 million for this year. The council ultimately approved $40.1 million for this year's jail budget in December. So in conclusion, if there is not a medical staff at the St. Louis County Justice Center after June and people start dying in the St. Louis County Jail, if they think that St. Louis County has an $81 million deficit now, if people start dying in the hands of the St. Louis County jail system without a medical staff or urgent care, these lawyers are going to hit St. Louis County like a tornado that happened last year. You will see a tornado, a deluge of lawsuits that will hit the St. Louis County courthouse and courtrooms like you will have never seen before. They need to get this under control. Those detainees are human beings, and they need the appropriate treatment, whether you're free or you're incarcerated. It does not matter. They're still people. Get the budget right. Tell me what you think. This has been the Trevor Donald Experience. Manifest your truth.